disconnected,
anxious,
afraid,
depressed,
stressed,
lonely,
hopeless.
Hi, I'm Nadia Chamberlain, an HR consultant at MaxPeople. Given the impact of these unprecedented times we are living through, as part of the Bell Let's Talk Day initiative, we wanted to chat about the impact of the COVID-19 pandemic on mental health and provide some recommendations on how you can best support your employees. Over the last year, we have seen some of our clients and their employees heavily impacted by this pandemic, from reduction in hours and pay to layoffs and terminations. On top of this, many have contracted COVID-19, had family members contract the virus, and unfortunately, some have passed away. Such unprecedented circumstances are bound to have implications on many aspects of your employees' lives, including their mental health. In a study completed by Statistics Canada last year, it was reported that 81% of Canadian workers reported that the pandemic is negatively impacting their mental health, indicating a significant drop in overall worker mental health since the beginning of the COVID-19 pandemic. There have been predictions from the Center for Addiction and Mental Health that COVID-19 related unemployment could result in up to roughly 2,100 excess deaths due to suicide in Canada during 2020 to 2021. The study also identified that certain groups are more likely than others to experience symptoms of anxiety and depression. These groups include women, people with children at home, young people, those who have been affected financially, and marginalized groups. As well, a study from Statistics Canada last year revealed that a greater proportion of participants from visible minority groups reported fair or poor self-rated mental health. With the pandemic ongoing, it is unclear what exactly the long-term impact of COVID-19 will be on mental health overall. However, there are things that employers can do to further support their employees' mental health at this time. Here are some key considerations that you can keep in mind. First, checking in more often and on a personal level with your employees, especially if you have moved to a remote arrangement. It is important to keep in mind that you want to keep in touch with your employees on how they are doing and managing throughout the pandemic. If you have moved your team to a remote arrangement, it is important to find ways to overcome some of those remote challenges, which can include identifying how you will maintain regular communication channels and providing socialization opportunities such as virtual events or happy hours. It is also important to keep a pulse on your employees' performance. Those struggling with mental health may show a decline in performance overall, and it's important to ensure that you have clear expectations set up for working from home and have regular touch bases to discuss successes and challenges. As leaders, your employees will be looking to you as a role model for resiliency, and it's key to be authentic and vulnerable with your employees to ensure that they're comfortable to approach you when they need help. You will also want to consider offering additional support for existing accommodation needs, particularly for previously disclosed mental health challenges. And lastly, we would recommend reviewing your current benefits program to identify if there is an AAP available or identify the need to invest in one to support the mental health needs of your employees. It is important to keep this conversation going as mental health is essential to your employees' well-being. If you need help on identifying ways to support your employees during this time, please reach out to us.